let's see the confirmatory mind symptoms of Aconite. Hahnemann says, if you want to choose Aconite homeopathically, then you must observe the moral symptom, and you should take care that these moral symptoms should resemble closely to Aconite. Then only you can prescribe Aconite. So moral symptom means mind symptoms. So Hahnemann says in order to prescribe Aconite, you have to match the mind symptoms. So for Aconite also, confirmatory symptoms at mind level are very important. So what are those confirmatory symptoms? First is elements from fright. So effect of fright, effect of fear. Even if that incident has happened 10 years back, the person will feel the intense fear as if that incident has happened yesterday. Maybe he has witnessed some accident, somebody's death, and he got frightened. Maybe 10 years back, maybe 5 years back, but the person will be having the equal terror, fear, fright of that thing fresh in mind. So the fright, the fear is mostly about fear of death. Second confirmatory symptom. So the Aconite is one of the most fearful remedies like calcarea carb, stramonium, gelsemium. But the main fear in Aconite is fear of death. He will be afraid in going in crowd. He will be afraid for crossing the road. Why? Because the main fear may be some vehicle will come and hit me and I will die in accident, or I will die in the crowd with suffocation, or anything can happen and ultimately I will die. So there is extreme, tremendous fear of death. Always remember. And as Aconite we know is very sudden, is very storm-like onset. So there will be a panic, intense panic. Okay. Because of fear of death, Aconite is not going to sit quietly. There will be lot of agony. There will be lot of yelling, screaming, shouting with the panic, with the fear. Oh, I'm going to do something. So in that panic, in that fear, Aconite person will feel, I am going to die right now in this moment. Oh, I'm dying. Please do something for me. So there will be impatience. There will be hurry. And as if he is finished, next moment he will die. So this kind of panic you will see in Aconite. And as we see, Aconite is very sudden, storm-like onset. So storm comes and storm passes away. Storm does not stay at one place, right? So this panic, this state also of Aconite comes and passes away also quickly. And this is the difference between arsenic, Aconite. Both have fear of death, both have anxiety about health, both have oh, I'm going to die, right? But Aconite person gets assured easily, get convinced easily. When Aconite person develops panic, he will develop in the extreme intensity. I'm going to die. He will be panic. He will be restless. He will run to the nearest clinic, to the nearest doctor. He will ask doctor to check BP. See, I'm having chest pain. Oh, I'm going to heart attack. Please check. And if doctor takes the BP, checks and tells the person, you are fine. There is no heart attack. Maybe there must be little bit acidity. You will be fine. Then Aconite person get reassured easily, get convinced easily. The intensity that storm comes, it goes also like that in short period of time. This is Aconite. But arsenic person will not get convinced. He will say arsenic is suspicious. He will say, oh, this doctor he don't have much knowledge. Okay, maybe he's doing the wrong diagnosis. Let me go to some other doctor, some specialist. Let me do some test. This is arsenic. But Aconite will get convinced easily, but something happens little, some pain in maybe hand again he will rush to the doctor with the same intensity, with the same panic. So this is Aconite. So easy assurance is also one of the confirmatory symptom of Aconite. And then one of the again most important symptom of Aconite is restlessness, because Aconite is from the trio of restlessness with arsenic, rust ox, And third remedy, obviously, aconite. So aconite will be very restless because of pain, because of fear, because of panic. So pain drives him crazy. That is what symptom we get in our materia medica, right? So they are terror stricken, right? They are very terrorized, frightened. So because of fright, they will run here and there, they will move, they will walk, they cannot settle at one place. They will be lot of anxiety inside and restlessness physically outside. So Hahnemann says quiet patient sitting quietly, calmly contraindicates the aconite. Aconite has to be very restless, has to be very hurried, has to be very impatient, has to be moving continuously when they are afraid, when they are in panic, when they are anxious, when they are in pain. So these are the confirmatory symptoms of aconite, and maybe in the next videos we will differentiate the restlessness of the arsenic, rust ox, and aconite also. Thank you.